You called me lead man of India, I'll tell you with reference to that. We realized that in India, throughout Southeast Asian countries, except US, UK and Australia, we were using leaded gasoline, leaded petrol. That means that was added as an anti-knock to prevent breakage of engine. But our engines were all modern. There was no need for tetraethyl lead. Still, they were adding because World Bank gave a lot of money to buy to India. India, we used to buy from some external producer controlled by Western world. We used to buy tons and tons of tetraethyl lead to the petroleum industry. Now, in 1996, most of our people had scooters, not cars. Their children were at the back. They were going behind some other vehicle. That was exhaust was there. They were inhaling. Lead has no placental barrier in a pregnant lady, no blood-brain barrier in a children. It reduces IQ. Now, how to stop this was the question. Now, think of a research. How to do that? Other countries have done, no need to reinvent wheel, but it will not be accepted by our government. What we did, we screened 23,500 people in 7 metros in the country. I was the director of the project. We measured the blood lead level with a finger prick. Costed 1 cent, 2 cents, not much more than that. We measured the blood lead level and we found alarming data. More than 53% of children born who are below 12 years of age as of 1999 had their blood lead level above 15 microgram per deciliter. Means their IQ is reduced, irreversible damage. Then what to do, how to bring back IQ or how to prevent it was the question. We went to an economist. We said, if IQ is reduced in 53% of children below 12 years today, what will happen to our economy? To do 4 hours work, they will take 6 hours when they are 20 years age. By 2020, annual economic damage in India, because if we continue to use leaded gasoline, it will be 600,000 crores, budget of 2 Jharkhand states. I took it to data with 1 slide to Government of India, Parliament Secretary, they won't accept it. They said, you scientists come with data, come with problem, we need solution. I said, yeah, the solution is don't use tetraethyl. No, World Bank has given money, we have purchased, we have to use, we have to give a report. You know what I did? Along with Admiral Dawson and Abraham George, who supported, we went to World Bank, took a letter from the World Bank chief that if developing countries do not introduce unleaded petrol by 2003, 3 years time, no more World Bank loan. When that letter was issued, I tell you, you know what happened? March 2000, throughout the country, petrol bunks had a board, unleaded petrol sold here, unleaded petrol sold here. What a fantastic simple research to help improve the health care. Now today, of course, after that we got Magiradhar Gyani, myself, we worked and I got lead content in the paint below 90 ppm, lead in food, lead. See, most of our agricultural products are rejected for export because it contains lead. Turmeric powder, for example, supposed to give you health, it is giving you sickness. This is, research is needed to change our attitude of healthcare processes without expense, much expenses.